My name is Edna Navarro-Vidaurre, and I am the Senior Community Engagement Associate at Illinois Action for Children. On behalf of Illinois Action for Children and the Consortium for Community Systems Development, we would like to welcome you to today's exciting webinar highlighting the accomplishments and lessons learned so far from the Innovation Zone. Today, leaders from North Lawndale, Pilsen and Little Village, and Cicero will discuss how they are developing a pipeline with cross-system partners to identify and increase enrollment of children from priority populations and high-quality early learning and development programs. Today's agenda includes a brief overview of the Innovation Zones, stories from the Innovation Zone leaders, a response from the Office of Early Childhood Development, and after the three presentations, Renee Tetrick, our Innovation Zone analyst, will facilitate our question and answer session where we will try to answer your questions as best as we can. To get us started, here are some housekeeping tips. This session is being recorded and will be available later on our website for viewing. All of the participants have now been muted. If you encounter technical issues, please use the chat box to send us a message about your technical issue or send an email to maya.wilson@act4chicago.org. As each presenter shares their story, we encourage you to please use the chat box to submit your questions, which will be used during our question and answer session. At this time, I would like to introduce Leah Powell, Director of Program Innovation, who will give us a brief overview of the Innovation Zone initiative. Leah?
Hi, Edna. Thank you. And thank you, everybody, for joining us for today's webinar. We're all really excited to be able to share with you some of the wins that have been going on in the Innovation Zones. The Illinois Early Child Innovation Zones are an initiative that have been funded through Race to the Top, the Early Learning Challenge grant. Our work has been designed to help the state learn which strategies are most effective in achieving the goal of ensuring more young children with very high needs are enrolled in high-quality early learning and development programs. The Innovation Zone communities have been using a community systems development approach, including using resources from the Able Change framework, as we've been working with existing collaborations to develop goals, test and implement strategies in one or both of the following areas. The Innovation Zones are working to enroll and serve more very high-need children in high-quality early learning programs, and some of the Innovation Zones are also working to increase quality in early learning programs in their community. We have 11 Innovation Zone communities statewide. They're located in Altgeld Gardens, Riverdale area, in Austin, Aurora, Cicero, Elgin, Englewood, Greater East St. Louis, North Lawndale, Pilsen and Little Village, the south suburbs of Cook County, and also in Williamson County. All of the Innovation Zones are doing amazing work, and they've come so far in implementing and adapting their initial strategies. The kids are really at the heart of what we're doing, really trying to make an impact in vulnerable communities for vulnerable families. And we're grateful here to be invited to share with you some of the efforts and the early wins so far. Edna, thank you, and I'll turn it back to you.
Thank you, Leah, for that introduction. Our first presenter is Amina Wyatt-Jones from the North Lawndale Innovation Zone. Amina?
Hello, everyone. Thank you for having me. I'm excited to be able to share the story of what's been happening so far at North Lawndale Innovation Zone. So just to give you a little bit of context about the community, North Lawndale is on the west side of Chicago. It is really known for having really nice, beautiful gray stone buildings. And also there are some really good staples in the community, such as a brand new healthcare facility that houses a state-of-the-art gym, a meeting space that overlooks the Chicago skyline. And for those of you all on the phone who are interested in possibly having conferences or meetings, it's a really great cost-effective space to rent out. And also there's a cafe called the Green Tomato that is absolutely delicious and serves healthy food. You all will love it. So on the flip side of things, there are some families that live in this community that really struggle. North Lawndale has one of the highest child poverty rates in Chicago. 71% of children between the ages of 0 to 5 are living below 100% of the federal poverty level, where 28% of these children live in extreme poverty. Okay, Next slide, please. So our zone has focused on the following priority populations due to what the data has told us about the community, as well as our experiences working on the grounds in this community. So our priority populations are homeless children, children of teen parents, children in the DCFS system, including foster children, children with disabilities, children in poverty or deep poverty, and children in home-based care who need supplemental early learning programs. And so that would represent children in FFN care, family-friendly neighbor care. Next slide, please. So before I get to the problem, just really quickly, our North Lawndale Innovation Zone consists of a diverse group of stakeholders that range from parents, mental health agencies, community-based organizations in Chicago Public Schools, early childhood education department, home child care providers, partners in the healthcare industry, homeless shelter, library, and other cultural institutions such as the Chicago Children's Museum. Also child welfare agencies, and you know what? From time to time, we also get children that come with their parents occasionally, especially over the summer when we're meeting. So, yep, children are a part of our zone as well, because that's what we're doing it for. So we started our work in October of 2013, where many of us looked at some startling data and found that 49% of 3- and 4-year-olds were not connected to any early learning programs. And that percentage represents, so 24% of 3- and 4-year-olds are in home-based care without an early ed component, so those children are in FFN care without an early ed component, and 25% were not accounted for and just off the radar, which we're thinking they probably are in licensed exempt care or family-friendly neighbor care and not receiving CCAP. So they're in the home somewhere, not in early learning programs. So after doing a deep dive and being on the grounds in the community, we found out many reasons why our children weren't showing up, and I listed a few above. So spring enrollment doesn't make sense to families. So families really aren't thinking about enrolling their kids in March or anytime before the school year starts. So a lot of times families are going, many principals have shared that families are coming in droves in August or when school begins, a little before school begins, because it doesn't make sense for them to enroll in March, especially for Chicago public school programs. We do know this community-based organizations enroll year-round, but you know the messaging is a little bit different for families, depending on what program they want to go to. And then many families are unaware of the full menu of eligible options for each unique family. So there are so many different early learning programs that are marketed. Which one is right for that specific family? We found that some were enrolled in programs and some intentionally did not enroll due to families' unpredictable work schedules. It was just interesting really hearing the differences in families. Like some look, I'm not going to enroll because this just doesn't make sense for my family. I'm just going to keep my kid at home with grandma. I remember meeting one mom who was a custodial worker at the local health clinic, and she shared that her son had missed so many days of school because the 8 to 3 schedule in the local public school that he was enrolled in didn't work for her and her family. And she thought really that was sort of the only option. However, after speaking to her a little bit, she listened closely when I shared that there were other options such as community-based organizations where she can bring her child at 6 a.m. or pick up around 6 p.m. So she was very interested in hearing that. Next slide, please. And I'm sorry, and just to finish that out, and then no enrollment sites in the community. We didn't have sites. Families were enrolling. This is for Chicago public schools. Families were going out the community to have to enroll their children, and not just out the community. Some places are really far for many of these families. And of course, high transients in this community. Families are in and out, in and out. Next slide, please. So as a result of the data, our zone came up with the following pilots. of which one was already coexisting, which was the parent engagement work. So we have the pipeline, building a connecting pipeline work, in which I will really expand on. Unfortunately, I only have time to expand on that today. Targeted outreach, where we were really strategic about setting up early learning information stations at certain times throughout the year in the community, where we would have a higher chance of meeting families in our priority categories, such as in the FCRC office or out in front at the local store. Also, of course, the parent engagement innovations that I spoke about a second ago, and connecting family-friendly neighbor care to formal early learning programs. So the goal for our pipeline work was to develop partnerships with organizations and other community entities that serve priority families to support the state's early learning efforts of getting children ready for kindergarten by 2021, and what does that really look like. And so being able to share with them our mission of our local community collaboration of North Lawndale Innovation Zone. So we really wanted to partner with these agencies. So we realized we needed to figure out how to make things easier for families, especially when you think about the toxic stressors on a parent living in deep poverty. It's like, why are many of our parents going to multiple places to inquire about an early learning program or even to enroll in these programs? They're going to different places. And so we're trying to figure out what makes sense, what could be easier for these families, and get our most vulnerable children in quality early learning seats so that they can thrive. We also learned that there were some other programs and organizations in the community that we could integrate these early learning efforts, in which you will see in the next slide. Next slide, please. So these are a pipeline of partners, and we put this here because these are really our active partners in North Lawndale Innovation Zone. We do have other partners, but these are some of, again, our active partners. As you see, the Douglas Library, and these are all referral partners. UCAN, the Child Welfare Agency, Lawndale Christian Health Center, Chicago Public Schools Home Visiting Agencies on the west side of Chicago, Lena Washington Homeless Shelter, TRIM, it's an I Am Able organization, a mental health organization in the community, and St. Anthony Hospital. I'm only going to be able to touch on 2 of these circles just so I can give my colleagues time to be able to share their great pipeline stories as well. But as you see here, Lena's Homeless Shelter, we were able, this shelter was sort of living in its own little silo in the community with very little partnerships with other organizations in the community to help families become a little bit more stable. We found that there were many families who needed to connect to an early learning program in order to find a job. So we developed an informal, very informal referral relationship with them to connect the children to either home-based, home visiting programs, or connect them to a child care preschool. We have a story of one mom, just a success story really quickly, of one mom who was concerned about her child's development. Her son was at age 2 at the time, and we got her child connected with the Carol Robertson Center for Learning. Once she enrolled, her child was immediately screened and received support with speech and occupational therapy. This mom later found a job and moved to the south side of Chicago. Do you all know that this mom to this day, even though she lives away in actually the southeast side of Chicago, she still gets up every day to bring her child to the Carol Robertson Center for Learning because she is committed to this program for him. And she just recently called a member of our team to share how great her son is doing and how much he has improved over time. So that's just one of the examples of the homeless shelter. In moving to Lawndale Christian Health Center, so this is actually a very new partnership. We've been building trust and building relationships with this entity for a while. We do have our monthly Innovation Zone meetings at the Lawndale Christian Health Center that I mentioned in the beginning of the slide every month. And so just by developing relationships, we were able to work out a very formal referral process with the head doctor and his team, where there now will be where they're adding an early learning page to their system, their system when their clients come in. So clients who have children that are 0 to 5, they are instantly connected to our innovation zone to get their children to be followed up and contacted to refer them to early learning program, either home visiting or preschool of some sort. And we're there to be able to talk to them a little bit about what program is best for them. And then because we have a full, we have a cadre of different early learning providers in the community, whatever makes sense for that family, we're able to kind of refer out and do that. Okay. And we're excited because we just finished putting the pieces together so we can begin receiving referrals this month. And so just really quickly, this is the referral flow chart. This is just how it looks when partner agencies, if you remember the graphic that you saw before this, this is sort of what the referral looks like, partner agencies and how it moves throughout and how they're contacted and followed up. And I'm going to go ahead and go to the next slide due to time. And so we've had a lot of wins, a lot of small wins. We've also had some challenges. I can talk a little bit about those challenges later at another time. But just some of our wins right now, we were really excited to share that providers are sharing slot information with one another. Referral partnership with Lawndale Christian Health Center is really huge for us right now. We're looking forward to that. Over 200 priority children are enrolled in early learning programs. It's amazing how many of those families have even shared back and just say, wow, they really love their new schools. We just received confirmation that 100% enrollment in all CPS, early childhood slots in North Lawndale, happened this year due to the larger efforts of Innovation Zone and the partners in the communities, is really to getting the word out and share with parents about the importance of early childhood and other programs and the diverse programs in the community available to them. Next slide. And so as I come to a close of my spiel here, just lessons learned so far. Innovation Zone ends in the end of 2016, but just so far, we know the relationship building is key. Integrating early learning into other community efforts, sitting at different tables to listen for triggers, to realize that, hey, it seems like this could help a parent if early learning, connections to early learning happen with these families. So we were able to do that with a lot of different organizations, make early learning messaging simple and to the point. Sometimes we just have to get out all of the funding stream, CCAP, Head Start. We just need to say, hey, mom, do you have a child 0 to 5? Are you interested in getting your child connected to early learning program? Sometimes just that messaging is easy for families to listen to. Ideas are easy, and of course implementation is hard. Our partners in Innovation Zone have lots of great ideas. So we just have to all work together to figure out which one can we implement at this juncture. And then lastly, and just find out what the data really means by listening to the parents in the community. That's what we have really learned to be really helpful in our work so far. And that is the close, and I'm looking forward to hearing from the other Innovation Zone pipelines. Thank you.
Thank you, Amina, for sharing North Lawndale's story. Our second presenter is Dr. Caridad Rosita Scheftel from the Pilsen and Little Village Innovation Zone. Dr. Rositas?
Thank you very much, Edna, and welcome everybody. I will share with you our accomplishments, adaptations, and lessons learned from our Innovation Zone. First of all, Pilsen and Little Village are two areas in the South Lawndale of Chicago. They have a very high concentration of Spanish-speaking families, mainly from Mexico, but we also find families from other countries in Central and South America. Some of the families have undocumented members, and most live under the federal poverty level. Our Innovation Zone has been very respectful of the culture, language, and traditions of the area. if I can describe the problem that we're facing in a few words, I will say that in our innovation zone, young children with cultural and language isolation are underrepresented in early learning programs. So the priority population we are targeting is children ages birth to 5 years, living at or below 100% of the federal poverty level, including children with undocumented parents. Next slide, please. We have been working with three main goals: increase capacity of collaboration efforts, facilitate outreach and enrollment, and build a pipeline of partners. I want to focus my presentation on the second goal, which is to facilitate outreach and enrollment of young children in high-quality early learning programs in our area. As I mentioned before, this innovation zone has been very respectful of the Latino culture when reaching our goals. Research has shown that many of the cultural values that characterize Latino families underpin a strong family relationship. They believe in family loyalty, they prefer a personalized style of interaction, and showing respect for elders and others in a position of authority, such as the priest, the doctor, and the lawyer, is very important. Trust is also very, very important for the Latino community. So we decided that in order to facilitate the outreach and enrollment of families and be respectful of their cultures and values, we will be supported by a group of parents ambassadors. These parents ambassadors are knowledgeable of the community. They speak Spanish and were trained by Coffee, one of our partners. During the months of April, May, and June, the parent ambassadors attended different outreach events in the community and also used the door-to-door strategy to contact parents. They used a map provided by Illinois Action for Children describing the areas where they can find the families living under the federal poverty limit. The parents ambassadors had a script where they were asking if their children were enrolled in an early learning program, and if this was not the case and the families were interested in a follow-up phone call, they provided the name of the parent or guardian, the name of the child, the date of birth, a phone number, and the address. The parent ambassadors left information about the different high-quality early learning programs in the area in case they want to start the outreach to these programs. The parent ambassadors collected information of 253 children who needed early learning programs, 91 from Pilsen and 162 from Little Village. Next slide, Ed. MOU to respect confidentiality, as well as to follow a process to contact these families in an orderly manner so we can have a system in place. Even though all of the core partners are experts in recruiting and enrolling Latino families, we create common tools such as talking scripts to contact families in Spanish, a tracking tool on which each partner updates the information of the family that they sign in to make a phone call, and feedback loops that allow us to reflect on our active learning process. From the total children contacted by the Pilsen Little Village Innovation Zone partners, 23% of the families were unable to be contacted. The family provided wrong numbers or the lines were disconnected. 77% of the families were able to be reached, either by talking directly to the parent or the guardian or by leaving a message with a relative or a message on the answering machine. So if we can talk about small wins, when the core partners were doing the phone calls, they found that 13% of the children were already enrolled when the follow-up call was made, which means that the information that the parents ambassador left was useful. And 11% of the families contacted agreed to enroll the children at the agency or the partner that was making the phone call in that moment. They follow process, and they also were following up so the families can bring all the documents needed in order to complete the uh, enrollment process. Next slide, please. Some adaptations that we made as part of our active learning process were the following. The scripts and documents were written in English, and a high number of families only speak Spanish, so we had to translate the documents. Also, after the outreach process, we discovered that some families could not be reached by phone, so letters were mailed. We really tried to stick to the preference of a personalized style of interaction by making phone calls, but we really had to think on a plan B. We also identify alternative ways to communicate as a core team. First, we use conference calls, then emails, and now we're trying to use online surveys to provide feedback. The Pilsen Little Village Innovation Zone has also been a safe space for peer support. Due to the current state budget issues, which it seems things are going to be better soon, we're hoping that, it has become very important to provide meeting time for partners to share their concerns and feel peer support. Icebreakers have been an important element to uplift our spirits and keep moving to achieve our goals. Finally, thinking about sustainability and that we only have one more year to work as an innovation zone, the work plan activities had to be reprioritized as a group. Next slide, Edna, please. There are so many lessons learned during this process. The first one is the importance of working in the community, appreciating and respecting culture and values. Being able to do the outreach and enrollment in Spanish is helping us to keep aligned to our goal of supporting the families with language and cultural isolation. Even though the outreach efforts and small wins, families are discouraged to try to enroll their children into early learning programs due to the current child care assistance program changes. This has become an opportunity to advocate for CCAP change to be reversed as a priority so we can continue to enroll children in programs and make a difference. So it is really a time to advocate and to keep advocating. And finally, as the Pilsen Little Village Innovation Zone, we all agree that the best lesson learned is the ability to work now in an organized and systematic way as partners by enrolling children and making a difference in their lives, especially when the families are new to this country. I invite you to follow us on our Facebook page by typing Early Childhood in Pilsen and Little Village. You can find some news and some outreach efforts and some of our partners, what they're doing, and some interesting information for our population, especially for bilingual population and new families coming to the United States. And I thank you very, very much for your listening ears. Now back to you, Edna.
Thank you, Dr. Rositas, for sharing that story from Pilsen and Little Village. I'd like to take a moment to remind everybody to please submit your questions for the Innovation Zone using your chat box. Our third presentation is from the Cicero Innovation Zone, and Nancy Caban-Vasquez will be sharing her story. Nancy? We are working on a little bit of a technical issue, so if you can hold on for one moment, we'd appreciate it. Thank you.
Okay, very good. Hello?
Okay, Nancy, you're on. We can hear you.
Good. Sorry, thank you. Okay, good afternoon. Thank you for joining us today through the Parent Ambassador and Pop-Up Preschool Program. The Cicero Innovation Zone educates and brings awareness about the importance of enrolling high-needs children into the early learning programs across Cicero. Here we see the priority population targeted for the Cicero Innovation Zone. The challenge is that highest need children aged 3 to 5, as defined by linguistic isolation for families at or below the 185% federal poverty level, are underserved by formal preschool and under-enrolled in kindergarten. We've learned that there is more need than capacity. The root cause are families are isolated, like in the Pilsen little village area, culturally and underrepresented. The location of available program slots are full or located far from the families, or hours of service do not match the family need. So a proposed solution is, what we've done is hire and train 6 lead bilingual, COFI trained parent ambassadors, and we have the capacity to hire up to 18 stipend paid parent ambassadors, which we've created teams to canvass the town of Cicero. An example of a team would consist of 1 lead and 3 parent ambassadors, and we've divided up the town of Cicero into 6 sectors and assigned these leads with ambassadors, 3 or 4 per section. And these are their assigned areas where they canvass on a regular basis. And then we meet back and report back our outreach efforts, and then we plan and we troubleshoot and strategize. So yes, so then we develop and implement a plan to recruit and train the linguistic and culturally sensitive parent ambassadors. They collect and analyze data to identify areas of deepest poverty and linguistic isolation for targeted outreach. So we obtain, establish, and test pop-up preschools in these high-need areas. And then, like I said, with the reports we get back, we are able to determine how successful or what are the outcomes or areas of need based on these reports we get back, the reports that we get back from the parent ambassadors. Next slide. So under Cicero Innovation Zone goals, the quality improvement in early learning programs, the goal is to attract stakeholders that are interested or in the process of obtaining the Accelerate quality rating. So one example is that we've collaborated with Through a Child Dies and the All Our Kids Network, or AOK network, and we held an Accelerate provider training that had really great turnout. The room was full of providers from the community and other communities from the Chicago area came out, and they expressed a high interest in becoming trained and getting the quality rating that they've even asked for another training. And we're hopefully going to collaborate with some provider from the community who has an association of providers. So that's a really good resource and link for us if we want to branch out to other family child care home providers and bringing quality to their family child care homes, where they could have that opportunity to collaborate with the innovation zones and what we're trying to do in connecting families to high quality early learning programs. So to serve more children from priority populations, to this day we have had 241 unique families visit the Cicero pop-up preschools. This last quarter, from July to September, parent ambassadors attended and did outreach at 13 summer community events and made a combined 498 contacts across Cicero. This last quarter, also from July to September, we've tracked and it's been reported that we have 45 families that enrolled in a high-quality early learning program. So by engaging families across the community, just shows that parent ambassadors are committed to engage families across the community by consistently attending community events, door knocking, and community outreach in general to laundromats, WIC offices, the library, the stores, etc. And most of our parent ambassadors are members of community committees such as Parent Patrol. They're parent leaders at the District 99, the Cicero Youth Task Force, Parent Involvement Committee. Also the Padres Unidos para Informar is a parent group that meets regularly, and the Education Committee meeting, just to name a few. And by our parent ambassadors being part of these various committees, their ongoing presence in the community, they're approachable, and parents, that when they approach parents, they're very responsive because they know them, they see them, and so this proves to be a real asset to us in our work doing community outreach. So to develop networks of social and health services, the Cicero Innovation Zone leads and or parent ambassadors are ongoing presence in the community at monthly meetings. The steering committee meeting is a new committee we attend, the clergy committee meeting, the McVie meetings, the All Our Kids Network meeting, the early childhood committee monthly meetings, and by attending these meetings, we're constantly bringing the Innovation Zone updates as well as networking with other stakeholders or potential stakeholders. Next slide. So here's just a few of our photos of the parent ambassadors engaged in training. And this was like really early on when they came aboard. So we took upon ourselves, to get them educated. They did get training from the COFI. So the Innovation Zone parent ambassadors, along with the McVie coordinated intake and the community systems developer, have created and implemented a pipeline that educates, assists, and supports families who have expressed an interest in enrolling their child into an early learning and development program that best fits their needs. By meeting regularly and communicating and creating collaborative systems with one another, we've been able to see firsthand that we can work towards a common goal and achieve desired outcomes. And there's nothing like the sense of satisfaction when you see a family that a parent ambassador encountered and invited to a pop-up that actually came and connected to a high-quality early learning program. So it does work. So community outreach done by parent ambassadors, by having regularly scheduled meetings. We do our Monday meetings with the parent ambassadors and the teachers of the pop-up preschools. We stay informed of updates in their outreach efforts, what works, what is not working, and we work together to find alternate strategies to reach our goals. Next slide. So this summer in our strategy adaptations, when parent ambassadors were engaged in door knocking and assessed that it was not giving them the outcomes they had hoped for, we got together and brainstormed strategies and thought it would be more efficient to reach families where they are. They saw the opportunity by to expand and outreach efforts and switch to doing their active community outreach by using the monthly community event paper called the Town News, which is at your right upper hand corner there. That's a picture of it. And that paper goes out to every home in the Cicero community, and it's full of information, events, things that are going on, advertisement. So this goes out to every home, and by having this every month, it's like a lead, and there's a calendar in the back of that the parent ambassadors use to plan and strategize where they're going to go out in the community, if it's in their sector, or just alerting other ambassadors, sharing that information kind of gives us a heads up of where they want to target and go out. So by attending scheduled family events at local park events, lunch programs, playgrounds, and they reported having much more open and direct contact with potential families. So that was like a strategy that we used in order to reach more families and have that open contact. They were open to it because they were probably attending an event that was family-child related, so the families were more approachable. And the ambassadors reported back having much more success. So next slide. Okay, as you can see here, we have learned that programs are full or have wait lists, but transportation seems to be the biggest challenge, as we're constantly hearing this from the families that come to the pop-up preschools, on our parent survey, reports from parent ambassadors, and so on. Lastly, the communication between programs, schools, and parents is a challenge, as school systems can vary one from another, and eligibility requirements can be somewhat confusing, and people are misinformed. And we see that in the community, especially with the families out here who are mainly Spanish speakers, and English may not be their first language in their second language, so sometimes it's intimidating to go to a school not knowing what you're supposed to ask or what have you. So these are things that we've identified and are actively trying to assess and work on to better help the children, the families of Cicero. And this concludes my presentation for the Cicero Innovation Zone. Thank you. Back to Edna.
Thanks to all three of the Innovation Zones for sharing your community stories. One more reminder to please submit your questions via the chat box. I would now like to introduce our next guest. Joanna Sue is the Community Systems Policy Director from the Governor's Office of Early Childhood Development. She will now share the state's reflections of the innovation work. Joanna?
Great, thanks, Edna. Can you hear me?
Yes, we can.
Okay, great. Well, I want to first start out by saying a big thank you to Edna and Maya and Leah and all the folks at Illinois Action for Children for making this webinar possible. And want to especially thank Amina, Dr. Rosita, Nancy, and all of their community partners for doing this very challenging work at the community level. But I hope that all of you know that your work has already helped to highlight for us at the state level kind of a roadmap of where we need more alignment and more supports to build systems at the state level and support all of you in your work with families. As in listening to the lessons learned from all of your communities and your work to connect pipelines, to do coordinated referral and the pop-up preschools and with the parent ambassadors, I did hear a number of common interests or themes. One thing I heard was that in terms of messaging, I think all of you are in the position of having to develop perhaps your own messaging and education about what are the early childhood education services in your communities, how do they fit together, why is it important, and I think that's an area where the state agencies could be doing a little bit more to provide some more aligned messages and a picture of how that all fits together, how we hope that would fit together. So that we can be sharing that with communities in a consistent way. Another thing that I saw is that Illinois Action for Children was able to provide community-level data to each of the Innovation Zone communities to pinpoint, where are some priority areas, where are priority populations located, where can you start your targeted outreach. And this is the type of information that community collaborations have been seeking for a long time and have had difficulty in getting. And so we at the state level, we are making some progress on some projects, and we would like to, I think we'll be able to come back to you in January with a webinar that provides a little bit more detail about that, what we expect, and more importantly, hear your feedback on shaping those initiatives. A third thing I heard was obviously the importance of family engagement through the great work of the parent ambassadors, and in helping to outreach peer-to-peer has is always been a very helpful model. And I think we would want to see a way to have a consistent way of having a family voice at the, not only just at the community level, but also to inform state policy and programs. And so that what we should be working for is to make our services more responsive and available to all families, including those who speak a language other than English at home, and especially those with very high needs. And so those are some of the things that we want to offer through a regional system of supports to community collaborations, and you'll be hearing about that more in the months to come. And an important piece of that is how can we have that ongoing feedback loop between the good work that's happening at communities in addition to the barriers that you're facing, and being able to share that directly with state agencies so that they can hear where the issues are and be able to address them. And so Leah and I and others in our office have been already talking about what are some ways we can start to make that happen on a regular basis. We don't want to have to wait. We don't want to have a delay between the time where families are having barriers and the state is able to hear about it and act on it. So with that, I just wanted to say again a big thank you, words of appreciation to all of you in the innovation zones and other community collaborations who are doing this hard work, and we want to be your partner in supporting families in Illinois. Edna, back to you.
Thank you, Joanna, for sharing your thoughts on the Innovation Zone work. Up next is Renee Tetrick, our program analyst, who will now direct the questions to the participants that you submitted via the chat box. Renee?
Great. Thanks so much, Edna. And thanks for those joining the webinar today and for all of our Innovation Zone presenters. I want to invite you to type your questions into the chat box. So go ahead and take some time now to think of the questions you have for our Innovation Zones. And you can type those right into the chat box. So let's take a look at some of the questions we've received so far. So here's one for all of our Innovation Zone leads. What are some strategies to help promote strong relationships between providers and programs? So maybe we can start first hearing from Amina in North Lawndale. What are some strategies to help promote strong relationships between providers and programs? So Femina, you want to go ahead and unmute yourself? We'll give Amina a second. Maybe we can move to Dr. Rositas in Pilsen Little Village. You want to go ahead and unmute yourself and tell us a little bit about some strategies to help promote strong relationships between providers and programs?
Sure. I think that one of our key elements is that before starting to work on a plan, we take a time to get to know who we were, who was sitting at the table, what were our common goals, our strengths, and also where can we support each other in our opportunity areas. I think that sharing and trusting, it's a very, very important element for the success of our interventions with the community. And also, I think that the same thing is applying when we're working with the community. We really are trying to convey to the families that we're there for them, who we are, how can we help them, And also another element is the listening ears, which is sometimes very, very difficult to do. So we try to hear each other at the meeting. What are our concerns? What are our interests? But also we're always trying to listen to the community. What are their struggles? Why they're not enrolling children in the early learning programs? And what we have discovered, and this is also supported by research, is that in the Latino community, especially with the young children, those who are babies and toddlers, they prefer to keep them at home with relatives or in a home-based care. So this has been very interesting for us to keep thinking, what can we do and how can we help these families transition to the high quality early learning programs that they deserve.
Thank you so much. I think we have Amina back on the line. Amina, how about for North Lawndale, for the work that you're doing there? What are some strategies to help promote strong relationships between providers and programs?
Yes, hi. Sorry about that, Renee. Just some of the strategies that we've been doing is just really trying to listen and find out what is it that is needed with partners. And when you say providers, you mean early learning providers, correct, Renee?
That's right.
Yeah.
That's right. So, yeah, that's what they're asking.
Yep, yep. And then one of the things, though, too, is also not so. We're all here learning, trying to kind of insert our efforts around early childhood at the tables, at other tables. But it's also important for us to build relationships and be at their tables as well. So I think that is one of the ways we've built strong relationships with a lot of providers by it's that reciprocity piece. Making sure that we're showing up to their events and that we're keeping a ear open for any triggers in terms of how we can support things from an early learning perspective too. So yeah.
Thanks, Amina. And how about Nancy in Cicero? Any ideas you'd
like
to share?
I always reflect on how consistency is key. I think that is like a really important factor here, persistence. No matter the ups or downs, as we've had our fair share, we've had our good times and our not so good times or our harder times, but staying, persistent. I just, we got to have strong leaders at the table. You also have to meet regularly. That's what we keep doing. We meet regularly. We have high communication amongst each other. We're supportive of each other, and we're open to collaboration. And all of this boils down to consistency. And Dr. she touched on how listening, that is important as well. I find when we do this, like, for example, with our parent ambassadors, we're listening to them, especially closely listening to them, because they're the ones out there in the community, on the front lines. They're the ones dealing with the community face to face. So when they come back sharing that information with us, we're listening, and we're even open to their feedback or their suggestions, or what do you think we can do or we should do. We're open to listening to what they feel because they're the ones out there. So then when they're bringing that back, we're working with them to troubleshoot and to try new strategies, and that proves to be very effective. But, like I said, we do our Monday meetings with the parent ambassadors, and sometimes I think, oh, is this too much? Are we, like, repeating ourselves? But they want to meet, and, and I'm like, okay, fine, we're going to keep these meetings going. They are important, and, this just reinforces that. Just having this conversation, because we are learning from one each other and supporting one another, but it all boils down to me to the consistency factor.
Thank you so much. We have another question here. Webinar attendees curious, is the waiting list long for families to be accepted, or do they have to meet certain standards to be approved? So why don't we turn to back to Dr. Rositas. Are you seeing long waiting lists for families there in Pilsen and Little Village?
Fortunately, most of our centers are in their full capacity. We have some families that are still on a waiting list, but unfortunately, the waiting is because of the changes in the regulations of CCAP. So now that it seems that things are going to be changing, we really want to reach out again to these families and contact them and see if how can we help. But we are making right now an analysis according to the population that we've been working, that the population that the parent ambassadors help us gather the information. We are making an analysis of the age ranges and keep working with our partners to see if they still have some availability, or also we're trying to make some predictions or try to think in advance from this small population that we're working right now. How many are there going to be able, or how many are we expecting to go into the 3 to 5 years old program and be ready, or even start sending some reminders about what's next in their educational path. So that's what we are looking right now, looking for.
That's helpful. Thank you. And how about in North Lawndale? Amina, are you seeing any waiting lists for families? And what are some of the eligibility requirements that you're seeing needing to be met?
Well, well, I can speak from two ends. So for Chicago Public Schools, this is the first time in history, actually, where these programs are completely full for Chicago Public Schools. Our problem is that many children weren't filling the seats, and so right now it's pretty full. However, on the other side of things, with community-based programs, there are some slots available. So we just need to get that information out to families about, kind of work together to make sure parents also know about other options. So yes, the CPS schools are closed, but there are other options for you. So we're trying to get that messaging to be something that's embedded in all the clerks that who have full slots, for them to be able to share that there are other spots, there are other options. So that has been happening with some schools, which is great, because I actually called myself, and so they would refer to the Ready to Learn hotline number, and they get them connected that way to whatever program.
Thank you so much. I know we're nearing the end of our webinar. I just wanted to turn it to Nancy real quick just to see, how about in Cicero? Are you seeing a waiting list there?
Yes, and this can vary from month to month and program to program. We have, on a monthly basis, have been hearing that at times. Like now we are at a time, we're in November, so the school year we know opens up in September. So we are hearing of waiting lists, but monthly, by having these monthly check-ins with programs, wait lists, we encourage families to get on a wait list, because again, that can change from month to month. Now, the added benefit for Cicero is that we have the pop-up preschools, and families that are coming through the pop-up preschools can be retained there until they enroll in a program. So they have the option of still coming to the pop-up until they enroll in a program, and then our goal is to help these families connect to a program. So it keeps us in the loop also when they're connecting, or a parent ambassador may even encounter a family that they didn't see in a little bit, and the student say, hey, where you been? Said, oh, well, I just got in a program. And so it's like the way they're connected to the community is pretty awesome, because then somehow we're still trying to stay in the loop of how these families are connecting. And while some might slip through the cracks, we're still trying to fish them back and try to get that information from them. So again, the pop-up preschool is like an added benefit for them, because they can still come to the pop-up until they connect to a program.
Thanks so much, Nancy. And thank you all for your questions. I'm going to turn it back over to Edna.
Thank you so much, everyone, for taking time out of your day to participate on this webinar. On behalf of the Consortium for Community Systems Development, we'd like to thank all of our presenters and our participants for joining us. We will be posting a recording of today's webinar on our Partner Plan Act website. That is the first link listed there. We also invite you to please register for our next 2 Innovation Zone webinars. The December one is featuring Williamson County and Greater East St. Louis, and they'll be talking about developmental screening work, which is on December 10th. And then our January one will be focusing on quality, and that will be with Aurora and Thornton Township. If you have any more questions, please feel free to send them to the Partner Plan Act at partnerplanact.org email address. Once again, thank you and have a good afternoon.